Hi again. I'm Rob Confessore, Dr. Rob Confessore, clinical exercise physiologist at the Summit Medical Fitness Center. Our topic today is the importance of resistance or weight training. Exercise, whether it's cardiovascular exercise or strength training exercise, as exercise scientists, we view it as a disruption of homeostasis, but it's a very positive disruption, and it makes the body stronger. Exercise really is medicine, and the effect of exercise on an organism designed to move is profound. There's a tremendous difference in the physiology of a human being at rest versus the physiology of a human being at maximum exercise. We know that exercise affects, in a positive way, heart rate, blood pressure, bone density, body composition, hemoglobin levels, oxygen delivery and extraction, and in many ways, it's all about oxygen. Blood glucose extraction. It also affects mood. It affects cognitive ability. You cannot separate the mind and the body. Our focus today is on strength training and resistance exercise. And so we're focusing on skeletal or voluntary muscle that's controlled by the nervous system. This slide depicts the physiology of skeletal muscle. When you're looking under a microscope at tissues, you cannot miss skeletal muscle tissue. It's very distinct. It has colored bands and it's striated. What's very interesting, sometimes an analogy, if you open up a packet of spaghetti and you pull out a single strand of spaghetti, when we teach this, that's analogous to a single muscle cell. A muscle cell averages about 40 millimeters in length, but some in the longest muscle in the body, the sartorius, is almost a meter in length, and a meter is about 3 feet. These are multi-nucleated cells that are controlled by the central nervous system. When we strength train, we get adaptations that are very different from cardiovascular training. And once again, the point that I make in each of my presentations, the body was designed to move. Strength training, resistance training has a tremendous effect, of course, on skeletal muscle and voluntary muscle, on bone, on blood glucose and nutrient intake, and hormone release. These are the tissues perhaps most effective by strength training, weight training, resistive type training. And these we call the physiological training effect. Quite different adaptations to that we receive when we train aerobically or cardiovascularly. When we think of aerobic exercise, the first benefit that you think about is a cardioprotective effect. Increasing oxygen consumption, getting more oxygen to the muscles, and protecting and strengthening the heart and the vasculature. But with resistance training and weight training, the focus is more on maintaining muscle endurance and strength. Muscle strength is defined as the ability to exert maximal force one time. We usually measure that with a 1 repetition maximum. Muscle endurance is the ability of a muscle to contract over and over again in the course of the activity. Resistance training is very critical to maintaining function and remaining independent with advancing age. And Independence is one of the most important psychological constructs there is. In addition, strength training and resistance training also have cardioprotective effects. How do you build muscle? You're breaking down muscle tissue during exercise. You're rebuilding muscle tissue in recovery. Remember, a muscle cell is 75% water, and it's composed of an aqueous water protein kind of milieu or mix. It is supported by adequate protein intake. The recommendation for individuals between 0.83 and 1.2 grams per kilogram of body weight per day. A kilogram is 2.2 pounds. An average male, that's about 56 grams a day. For the average female, about 46 grams per day. We use the FIT principle in terms of prescribing resistance training. Frequency, how many times per week? And the basic recommendation is 2 to 3. The intensity, how hard are you working? What's the volume? How many reps for each exercise? How many sets? The recommendation initially, 12 to 15 repetitions, 1 to 3 sets. Time, it should be initially slow, deliberate motion with perfect breathing, full range of motion. The type, anything, using your own body weight, using dumbbells, using machines, balls, barbells, resistance tubes, or bands. We have to defend muscle to the death. As a college professor, I actually used that statement to those I was training to go into the exercise science field. Increase muscle, decrease body fat percentage. Muscle burns more calories at rest. It increases the number of calories that you expend resting during 24 hours. We call that REE, or resting energy expenditure. With aging, we have a decrease in resting energy expenditure, and that decrease is wholly explained by a loss of lean body mass or muscle tissue. So it's imperative that we add resistance training and strength training to our cardiovascular and flexibility training to have a complete workout. The recommendation is not that you become a bodybuilder. The recommendation is that you resistance train on a regular basis, even if it's with your own body weight. It is extremely important, and it is part of training sometimes that is second fiddle to cardiovascular training. And interestingly, in our field now, both of those two types of training are actually viewed as equally important. So it's extremely important. It's also important to progressively increase the load safely as you get stronger. We call that progressive resistance. Come to the summit. Work with our personal trainers and specialists. Let us show you how to strength train safely and correctly. And then please make sure that you incorporate it into your overall fitness or exercise programming. Take care.